Joining me right now to talk more about the quarter and what is ahead is the CEO of Moderna, Stephane Bancel. Stephane, thanks very much for being here. What a blowout quarter. Congratulations to you.
Thank you. I'm very proud of what the team has achieved. It's incredible, Maria, when you think about it, in January 2020, we had 800 people, never run a phase 3, never launched a product. And the year that the team has achieved, the hundreds of millions of lives we have impacted, and the financial performance are really incredible.
Yeah, you have had an incredible scientific team, and we've talked about that many times, and it is showing up in your overall financial status. Stephane, I want to get your take on any direct or indirect impact from what we are seeing in Eastern Europe this morning. As you know, Russia has invaded Ukraine. Does Moderna get affected by this? What are you expecting?
So it's a bit early to know, Maria. It's, of course, extremely sad and a really tragedy to see what's happening to Ukraine and to people in Europe that are very scared right now. I hope it will be solved quickly. If you look at it, this is not a very large country, so this is not a big impact to us if it stays contained to Ukraine.
Okay. The world, of course, has been suffering from COVID-19 now for almost 2 years to the date when we first started worrying about this pandemic. Where are we in the pandemic? You made some comments last week in terms of being on the tail end as the CEO of one of the most important companies in this pandemic. Where are we in this pandemic today, Stephane?
So I think that there's an 80% chance, Maria, that we are moving into an endemic setting, so that's going to look like flu, meaning people at high risk will need an annual booster, or people who don't want to be sick. Like I've been taking a flu shot for the last 20 years, not because I was afraid of getting hospitalized, because I'm pretty healthy, just because I didn't want to be sick. And that's, I think, what's going to happen, an annual booster, which is why, we're working on adding flu to our COVID vaccine in a single dose, and then adding more viruses like RSV and others that get people sick or hospitalized or dying. I think there's a 20% chance that we might have a new variant that is more virulent, causing more disease than what we had with Omicron. I think it's maybe a 20% chance. We should never forget that Delta, despite coming after Alpha, was more virulent than Alpha. So I think it's a low likelihood scenario. We put it around 20%, but we should not forget it. So we're continuing to stay vigilant and to follow every variant of concern so that we are ready to help as many people as we can.
People are confused about the booster shots. A lot of changing information, of course, the CDC extending the period that people should wait between shots. What can you tell us about that booster shot? Moderna has been working on a booster shot specifically targeting Omicron.
That's correct, Maria. As soon as the Omicron variant appeared, we raced after it. Within hours, we basically designed a new vaccine specific to Omicron. It's now in clinical studies in the US and in the UK. And this morning, we are announcing actually a new vaccine candidate that has the old vaccine, the one on the market, the Wuhan strain, and the Omicron. So 2 mRNA molecules in one vial to provide a broader protection. So we want to be ready with anything that biology will throw at us by the time the fall comes, because I'm not too worried about the next few months in the spring, summer. I hope we should have, if we're in my 80% scenario endemic setting, we should have a much better quality of life. But I worry about the fall because we're going to be indoor again. And also immunity is going to wane. I think what is hard for people who are not familiar with biology to really appreciate is that as you are older, your immune system is mostly protected by your antibodies. And antibodies go down over time. And so we should not forget that most people in the world have not been exposed for many years to COVID. Unlike we have with flu, think about you and I. When we are young, teens and young adults, we've been exposed to flu a lot, either through infection or through vaccination. And so we build memory. But for COVID, you and I have no memory because we've never seen this virus before 2020. And so I think that's an important piece that people need to keep in mind, is that people that are at risk or older will need an annual protection.
Yeah, well, perhaps, but investors are watching this situation and looking at a blowout quarter that you have had at Moderna and wondering how you're going to keep this going. You did say that you will sell at least $19 billion of the COVID-19 vaccine this year, reporting a very strong fourth quarter. I know that your scientists are working on using that mRNA technology on a whole vast group of disease, even cancer. Where are you on that? And tell me about the pipeline in terms of what you're expecting Moderna to produce as a result of this mRNA technology.
Yeah, so as you said, we're expecting higher sales this year than last year. Last year, 18.5 billion, as you said. We've said we've already have signed contracts with down payments for $19 billion. And we have $3 billion of option contracts that have not been exercised yet. And we still have many discussions ongoing. So this could even potentially be higher. And then for 23, we already have also contracts signed by many countries, including the UK. And we're also trying with countries like Canada and Australia to set up 10 years agreement where we build a plant in the country and they pre-purchase 10-year worth of respiratory vaccine. The pipeline now is very large, 44 drug candidates, which is extraordinary for a small company. And in vaccines, we have a lot of programs that are going to have interesting data, including the flu phase 2 data very soon. The RSV vaccine for another respiratory virus moved into phase 3 on Tuesday this week. We have a big portfolio of latent viruses. Those are viruses that stay in your body forever. And those franchises, if you look at two latent viruses that have vaccines today, like HPV from Merck, it's almost a $6 billion franchise. The VZV from GSK is almost a little bit of a $2 billion franchise. So there's a lot of latent viruses like this, like CMV, which we have in phase 3 now. I believe it's a $2 to $5 billion annual peak sales product. And then, as you say, we have rare disease that's going to come this year with clinical data. And also cancer. We're expecting this year clinical readout for a cancer drug.
Wow, that is just tremendous. And obviously, we're all hoping that you have serious success with that, Stephane. I've got to end on this story that has been circulating. No doubt you saw it about the origins of COVID. We've all been trying to understand how this started and whether or not this did come from a lab in Wuhan. Let me ask you what the Daily Mail is reporting. It says more evidence COVID was tinkered with in a lab. Now scientists find the virus contains a tiny chunk of DNA that matches sequence patented by Moderna 3 years before the pandemic began. Your reaction, Stephane, what can you tell us? So
my scientists are looking into those data to see how accurate they are or not. As I've said before, the hypothesis of an escape from a lab by an accident is possible. Human makes mistakes. So is it possible that the Wuhan lab in China was working on viruses enhancement or gene modification, and then there was an accident where somebody was infected in the lab and then infected their families and friends? It is possible. On the claim you just mentioned, the scientists are analyzing to know if it's real or not.
Yeah, I mean, I was struck by the line, it matched a genetic sequence patented by Moderna for cancer research purposes, Stephane.
Yeah, and that's the type of things that the team is looking at very carefully to know is it real or not. Okay. So it takes a bit of time to analyze all the genetic sequence.
Well, Stephane, again, really important work that you and your scientists are doing. We thank you so much for walking us through it this morning. Thanks so much, Stephane Bancel.